I've been having this pain in my lower back. Yesterday I decided to go running, and I think that's what caused it.
Okay, so you weren't feeling the pain before that?
I wasn't feeling any pain before that. And then like I just feel like a tightness. It's not like it's a sharp pain, but today I worked out again, and I could feel it slightly again.
Okay.
Like the tightness of it. Yeah, the tension.
Could you show me where?
It's like right here.
Okay. So I got a pretty good idea about what's going on. A lot of times the pain and tension in the low back can actually be coming from the hip flexors just because they attach to the lumbar spine, go through the pelvic floor, and then attach to the femurs. So we're going to do a quick test. So go ahead and lay face up. We're going to do a quick test. I'm going to have you hold your leg right here. Hold it up. Don't let me push. So you see how that's nice and strong?
Yeah.
Now we're going to come to this side, and a lot of times when you get trigger points in a muscle, it'll interfere with that muscle's ability to contract. Hold the foot up and don't let me push. Resist. Can you resist? Go ahead and resist. Yeah, there's a little cavitation, but you see how weak that is compared to the other side?
Yeah.
So what we're going to do is we're going to work on that hip flexor. You just tell me if I'm too rough or anything like that. So we start at that insertion point, right on that quad. You look like you're really enjoying that.
It's not bad.
Good. So then the next one, we're going to go into the belly of the muscle. So, yep, we're going to bring this foot up and we're going to straighten out.
Okay.
You okay? Am I being too rough?
It's a little tight.
A little tight. Just breathe into where you feel it. I can really feel that tension right under my finger. She's trying to rip my hand off. We're going to stop and we're going to retest. Go ahead and we're going to recalibrate.
Okay.
So hold this up and resist. Resist. Okay. Do you see the strength difference?
Yeah, I do.
Yeah. So a lot of times when you get trigger points in your muscles, like I said, it'll interfere with that muscle's ability to contract. But when you have a lot of tension, especially in the hip flexors, it's going to interfere with your ability to do the glute activation. So you're going to get less from your workouts. Yeah, so it's really important to come get checked. Yeah, we can really see how high that left hip is, and that's creating the short left leg. So just feeling kind of side to side, the different fascial planes that run across the back. And I'm just focusing on this side because it's a little bit tighter. I'm going to have you take a nice deep breath in and hold it. Oh, poor Deja. Yeah, a whole lot of stuff on this left side. So we're going to, this time, deep breath in and all the way out. Good job. And we're just going to finish with the rib heads. So I just want you to relax right here. Perfect. Okay.
Oh gosh.
Yeah. Let me have you on your left side to start. Isolate that segment. There it is. Let's go to the other side. And let's go face up. Oh, just let me move the neck. Yeah, perfect. And can you wiggle your toes? There we go. Okay.
When you were stretching my hip flexor, should I be laying down and digging into it?
So there's a whole bunch of different ways you can do it. My favorite is getting, like, you'll lay face up, kind of take a little bend in the knee. You'll pull a lacrosse ball in that tender spot, and then you put a kettlebell or a weight on top, and you just kind of move it around. Since the fibers run up and down, you're going to get the most kind of crossing the fibers.
Okay.
But if you're just trying to stretch, I mean, any type of split squat with that right leg back is going to be really nice. Yeah.
Yeah.